Emily Drake. I'm a nurse practitioner in the Thrombosis and Anticoagulation program at Boston Children's Hospital. Today on Clot Chronicles, I'm going to discuss a recent publication on the rate of thrombosis in children and adolescents hospitalized with COVID-19 or MIS-C published in Blood in July of 2021. This study was a large multicenter retrospective cohort study to determine the incidence of thrombosis in children hospitalized with COVID-19 or MIS-C and to determine the associated risk factors in a total of 853 admissions in 814 patients between March 1st, 2020 and August 15th, 2020. Patients included in this study were divided into three subgroups for analysis, which were the categorizations of COVID-19, MIS-C, and asymptomatic COVID-19. The first key observation in this study was that the patients with MIS-C had the highest incidence of thrombosis at 6.5%. Patients with COVID-19 was the next highest incidence at 2.1%, and patients with asymptomatic COVID-19 having the lowest incidence of thrombosis at 0.7%. In putting these rates into perspective, the authors point out that the rate of VTE in children admitted to U.S. tertiary care hospitals in 2007 was estimated to be at 0.58%. Another key observation from this study was that the incidence of mortality was 2.3% in hospitalized children with COVID-19 or MIS-C, but was significantly higher at 28% in children and adolescents with MIS-C or COVID-19 who developed thrombosis. A third important observation from this study was risk factors significantly associated with thrombosis, where patients that were 12 years of age or older had a cancer diagnosis, presence of central venous catheters, and a diagnosis of MIS-C. Additionally, a D-dimer of greater than 5 times the upper limit of normal was significantly associated with thromboembolisms in this study, a similar finding to multiple studies of adult patients with COVID-19. Another interesting finding from this study was that more than 2/3 of thromboembolisms that occurred in hospitalized children with COVID-19 or MIS-C occurred in patients receiving thromboprophylaxis. This raised concerns and questions about optimal thromboprophylaxis for patients admitted to hospitals with COVID-19 or MIS-C. This study raised key considerations in what patient populations thromboprophylaxis should be considered, and additionally, what degree of thromboprophylaxis should be administered. Thank you very much, and I hope you enjoyed this review of incidence of VTE in children and adolescents hospitalized with COVID-19 or MIS-C.